We need to reduce our exposure to the spread of COVID-19 so that we in turn don't expose others. So we need to think and we need to plan. And nowhere is this more important than the upcoming holiday of Thanksgiving. Taking no precautions and celebrating like normal is a recipe for disaster. There are low-risk things that we can do to stay safe, and we've talked about this. We talked about it last week. I just want to remind, holding Thanksgiving via Zoom is a good idea, or considering celebrating outside, perhaps with space heaters or bonfires, is a low-risk activity. Celebrating with only those members of your immediate household is a low-risk way to celebrate the holiday. We encourage people to use these low-risk options. There's a level of medium risk, dropping off meals to family members, arranging, if you have to be inside, arranging a restaurant-type indoor setting with open windows, masking, and social distancing, staying in your small groups, not mingling with those that you generally don't interact with, or considering a Friendsgiving, celebrating with people that are already in your bubble. And then there is the high-risk behavior, inviting the uncle who doesn't believe in COVID-19 to the home for the holidays, proceeding as though there's no virus, and treating this like any other holiday. This is not any other holiday. And we obviously discourage people from engaging in these high-risk behaviors. So now is the time to make a plan. Lower the risk and think about celebrating differently this year. And really, this extends to our daily lives. Every day we should be thinking through, how am I going to approach the day and try to lower my footprint, lower my risk, lower my exposure as I move around in my daily life. We've been doing this for months. We've been trying to reduce our exposure and our, infecting others. But this exposure piece is something that we're trying to focus on now, because many of us have remained safe as we've adjusted our daily lives, but continued to work and go to school. But it's time to think about how we continue to shrink our exposure to other people, because we don't know. So many people are asymptomatic. We don't know who has COVID-19. So that's our plea to you in the community. I will tell you, my family, there are many of us, we're not getting together for Thanksgiving, obviously. And my mom suggested that we do a Zoom call. And so that's what we're going to do. And I will tell you, it breaks my heart not to be with my mom on Thanksgiving, but she prefers the Zoom call. And so we're all going to get on Zoom. We might play euchre. There's evidently an app where you can play euchre on Zoom. And so we're looking into that to try to celebrate together, but differently this year. So along that vein, talking about lowering your risk and lowering the COVID footprint, during the state of emergency, we at the county have been able to conduct business virtually by way of the state legislature. They gave us the ability to have virtual meetings. We did not have that ability prior to the state of emergency. So we've met in person for our meetings since the start of the pandemic. We've held only virtual public meetings where the public is invited to join by computer or by phone. That provision by the state legislature that allows us to meet virtually expires December 1st, 2020. And we also, remember, have budget hearings 2021. We are very grateful for that. I'm very hopeful that that will pass. I have no reason to think that it won't. I know it's got bipartisan support. So I guess the idea is that we will continue to meet virtually until it's safe for us to meet in person. So that's all I have. As always, I'm going to turn it over to Health Commissioner Greg Kesterman to run through the numbers and the trends, and then we will go to Nick Crosley to talk about the vaccine.
Good morning. Over the last 7 days here in Hamilton County, we have continued to see a monumental increase in the number of COVID-19 cases. These cases have resulted in a significant increase in hospitalizations, as well as intensive care unit admissions here in our region. I want to start by reminding everyone it is okay to get tested, and here in Hamilton County, good morning. Over the last 7 days here in Hamilton County, we have continued to see a monumental increase in the number of COVID-19 cases. These cases have resulted in a significant increase in hospitalizations as well as intensive care unit admissions here in our region. I want to start by reminding everyone it is okay to get tested, and here in Hamilton County, we have a lot of opportunities to get tested thanks to the Test and Protect program. Feel free to visit our website, hcph.org, and you'll be able to view a map and see where those testing locations are. I think the most important thing that I say every week is that if you're feeling sick or you get tested because you're feeling sick, please keep that sickness at home and wait for your test results. The last thing we want you doing is spreading COVID-19 in the community. Looking at our numbers here in Hamilton County, over the last month, I've continued to report that we've had our worst week on record with COVID. Our team, last week, I reported 333 cases. We are now, as of Saturday, our worst day on record was 494 cases. Our team was very busy this weekend responding to each one of those positive cases and attempting to call everyone and make sure that they kept sick at home. Our contact tracers continue to see that COVID-19 is spread throughout our community. There's no one source for these cases. Although I think it's worth pointing out, of the 4,000 cases Commissioner Driehaus indicated came from the last week, of those, 831 of them came from those in the 18 to 29-year-old age group. Unfortunately, though, those that are in the 70 to 90-year-old age group had 326 new cases. We know that the older you are, the more susceptible you are to serious illness, and this clearly has an impact on hospitalizations. Similar to our case number, we do see our reproductive value continue to be elevated and rise slightly. Today's reproductive number is 1.40, and for the region we are at 1.32. We have been above 1 now for over a month and a half, so we are continuing to see the virus spread within our community. As mentioned, hospitalizations for Hamilton County and the region continue to rise, although from the top left chart you can see that Hamilton County hospitalizations are slightly not as elevated as they are for the region. This has been the one metric that has kept us from going purple, although you can see some upward trend throughout the last couple days. When we look at the region, significant changes have happened. In October, we were at around 80 cases. Unfortunately, now we are at nearly 550 hospitalizations within our region's systems. This is putting significant strain on staffing as well as availability of beds. So we are seeing our hospitals collaborate and work together as systems to make sure that they are able to respond. Our intensive care unit admissions are similar. We were at 25 at the beginning of October. We are now 5 times that at 125 intensive care unit admissions. As shared last week, in response to try and curb some of this new growth of cases and hospitalizations in Ohio, Governor DeWine indicated that there are some new requirements for retail businesses. First, he indicated that businesses must post signs as well as enforce masking requirements. The state, through the Bureau of Workers' Compensation, will begin inspecting these facilities when they receive complaints. They also indicated they will be doing random inspections. You can visit our website and we have information on how to file a complaint, or if you file a complaint on our website, we are happy to forward that along as well to the correct inspection agency. Our office will continue to inspect at restaurants and other non-retail settings. So I want to plead with everyone, as we see COVID in our community rise, I'm asking everyone to just stay at home as much as possible. We are trying to get a handle on these hospitalizations in these cases. With COVID at its current level in our community, we are asking that you do not have guests over to your house. We know that this will increase COVID-19. We know that this is the case, and I have been saying this throughout the pandemic. If you are invited to go to a guest's house, now is the time to reconsider, and I would encourage you to say no, not at this time, and this is a choice that will help keep your family safe. I also want to ask that everyone, when you're in a business, whether it's a business, a restaurant, no matter what type of place you're at, please wear your mask, except for when you're eating job to do, and they're tired as well. They've been trying to make sure that we have the things we need throughout the pandemic. So I continue to ask folks to be respectful to them. And if you see somebody doing a good job, I'd encourage you to take a moment and say thank you. It's not easy for any of us, this pandemic. So in wrapping up, the governor did issue an order to prohibit gatherings as well. Really, in that order, he also mentioned the 10-person prohibition. That has been in place since March, although this is kind of a refresher and a way to remind people that 10 or more people are not allowed to gather in Ohio in line with the Ohio Department of Health's orders. The governor further indicated there is a curfew in place from 10 p.m. to 5 a.m. The goal is really, as Commissioner Driehaus indicated, to reduce those activities and our COVID footprint and to help keep us safe. I've been saying for months now that we have the ability to get through this pandemic and to play a role in stopping the spread. We as a community have succeeded before, and I really do believe that we can do it again. It's important to wear a mask, social distance, and wash your hands. These are the 3 tools that we will have that will get us to the point where we will successfully be able to get vaccinated and to put an end to this pandemic. Let's continue to work as a community, and I think we'll be successful. Thank you.
Thank you, Greg. So now we're going to turn it over to Nick Crosley. So Nick Crosley is the director of the Emergency Management Agency. This is the agency that is going to receive the vaccine, house the vaccine, and then distribute the vaccine in this community. And so Nick is kind of the coordinator amongst many others who are all working to make sure that we are ready for a vaccine when it becomes available to this community. So with that, I'm going to turn it over to Nick.
Thank you, Commissioner. As Commissioner Driehaus stated, Hamilton County Emergency Management and Homeland Security is coordinating the development of our storage capacity, the process by which our local public health entities and other governmental agencies can access the vaccine for their distribution. Just as a little bit of background, we have been activated to respond to COVID-19 since March, and we continue to be activated. We operate our Emergency Operations Center virtually, and have been working closely with both Hamilton County Public Health as well as the other public health agencies as we've dealt with this pandemic. So what we'll be doing, so we started out about 3 months ago talking through what does vaccine reception look like, what does storage look like, what might be asked of local government as far as storage is required. Now, understanding, of course, and this has been out in many media outlets, the vaccine will be distributed via many channels. Direct ship to medical providers, direct ship to major drug chains, and also direct ship to local government entities. So in Hamilton County, in talking with Commissioner Kesterman and Commissioner Driehaus and Administrator Oludo, I posed the question, what can we do as an agency to support the reception and distribution? And so we sort of coordinate this with our mission that we've been engaged in since the beginning on distribution of personal protective equipment for the community, and using the same space that we have. We have a secure location. We have purchased 2 walk-in freezers, 1 walk-in refrigerator, and we have also, as of the middle of December, we'll have our own ability for ultra cold storage, which is primarily the Pfizer vaccine at -90 Fahrenheit. So we're very satisfied with the progress that we've made. We anticipate installation of most of the capacity by the end of November. We have a secure location. We have purchased 2 walk-in freezers, 1 walk-in refrigerator, and we have also, as of the middle of December, we'll have our own ability for ultra cold storage, which is primarily the Pfizer vaccine at -90 Fahrenheit. So we're very satisfied with the progress that we've made. We anticipate installation of most of the capacity by the end of November, which is ahead of schedule. When it comes time, with that also comes a complete security system, backup power, backup refrigeration capability, so that we want to be able to ensure and reassure the public that whatever we can do to make sure we're prepared to receive the vaccine, store the vaccine, keep it safe and secure, and make sure that public health and our first responders and others have access to the site, that's what we've put in place. And so moving forward, once it's installed, I will be meeting with we have 4 public health districts in Hamilton County, Hamilton County Public Health, Cincinnati Public Health, Norwood, and Springdale. I'll be meeting with the health commissioners and various first responder agencies to discuss both to overlay and lay out the capacity that we have and the capability, discuss access control, and then distribution and the support required from the county and our agency as we move forward. We anticipate this mission continuing all the way until next summer, and we are prepared to support that through then or longer if needed. We are very fortunate to have all the major hospital chains based in Hamilton County. We have a lot of capacity in Hamilton County, and ours is primarily to support the public infrastructure, any kind of public outreach that we're doing, and we'll move forward with that capability as long as needed.
Thanks, Nick. I do want to note, I don't know if you said it, that COVID-19 dollars are being utilized to provide for this storage. So we've had the capacity to purchase a warehouse, purchase the equipment necessary to store a vaccine at different temperatures because we've received those COVID-19 dollars. That we're very grateful to the federal government for previous action to allow us to use those dollars for that purpose. So with that, Bridget, I think we're ready for questions.
Commissioner Liz Engel from the Business Courier has a question for you.
Yeah, what kind of investment are we making for this storage capacity?
I would say, I was just looking at, we're probably all in at $250,000. Is that what you were asking?
Yes. And that's the COVID dollars Denise was talking about?
Yes, that includes the refrigeration capability of the 4 units, as well as backup generation, power protection, security system, the whole thing. It's about $275,000.
Thanks, Liz. Our next question comes from Marielle Carbone. For you next.
Hi, Nick. Yeah, I have a couple of questions. I guess to first start off, what are some of the challenges that you guys are still facing in trying to organize all this? I know I read an article, I believe it was Politico, just stating that some states are concerned about getting the funding to actually promote getting out these vaccines and making it happen, like millions of dollars that they're short for this, as well as just not knowing how many doses you'll get, so that makes it hard to plan for who will be the primary targets for the vaccine first. So are you guys facing that? And if so, or if not, what other challenges are there?
So, again, having been through this somewhat before with H1N1, I do anticipate the federal government allocating the funds necessary for the sort of the last mile, if you will, the distribution to the community. So they've allocated the funds for the development of the vaccine. With some of these companies, they're paying for the actual vaccine itself so that it's at no cost to U.S. residents. And then I anticipate future funding coming through HHS and our FEMA to help get to that last mile and get it out to the public. Our challenge is that we just don't know the who, what, how, where, and when of vaccines that are coming in. I was actually just talking to Commissioner Kesterman about that. And so the way that I handle things like that is I am proceeding with a sort of a concept of operations in my head of what the public will be asked to do, what government will be asked to do, and then we start building our capacity. So we weren't necessarily told to develop this level, or they didn't actually tell us what cold storage to develop. We anticipated as a large urban county that we would have a lot of need, and so we had tried to anticipate that need, so we purchased and installed it, and will manage the vaccine reception and storage. Moving forward, we've had discussions with our health commissioners, and we'll continue to have discussions on how conceptually we will distribute the vaccine and vaccinate the public that are not getting it at some other source. And so again, we develop that concept of operation, we build to it, and then in my line of work, we expand and contract as needed so that we sort of plan for the worst case scenario, if you will, so that the maximum that we might be asked to do, and then we can scale back from that. So we've started putting some of those procedures and processes. I know Greg has. I know I've talked to Dr. Moore at the City of Cincinnati and the other health departments. They've started looking at how they would handle it internally. And then also, as I talk to the four of them, what might be asked of my agency and or the county to support that. And so I've started and been having ongoing conversations with Chairman, President Driehaus and Administrator Ludo to make sure that we have that capacity in place as well.
Awesome. And when you talk about capacity, those refrigerators and the cold storage, about how many doses can we actually handle at a time with all the storage we have in place right now?
Well, it's a lot. So, I don't have exact. So if you think of, I was the pizza box analogy with how many doses that holds, and I can't remember the exact number, and then you put that in a 10 by 10 walk-in freezer with the shelving that we've put in there. So we can hold quite a bit. And I wanted to mention also that it's when I talk about partnerships, obviously we partner with our local communities, we partner with our local first responders. I meet weekly with a working group from all the hospitals and nursing homes and a lot of other groups that are both the at-risk and community-based groups. And then, of course, we work a lot with the Health Collaborative. So it's been it's actually been while obviously an unknown process because of the partnerships we had pre-pandemic and the way those partnerships have been strengthened. I think we have the capacity to store tens of thousands of doses in our own capacity. And then, of course, looking at because we have so many health systems in the metro, we actually have quite a bit of capacity within the metro.
Awesome. And just two quick things here. I want to confirm, I know last time you spoke, you mentioned that the county has about 200 pods or points of distribution sites planned. Is that number still accurate?
Yes, open and closed pods, yes.
Okay. And then just lastly, do you feel like we are prepared for as soon as that vaccine comes that you guys will be able to successfully get this out to people?
Yes. We have the relationships. I know all the health departments are working on and finalizing their plans and procedures. We have the personal protective equipment on hand to protect the workers that are distributing the vaccine. We will have the capacity installed by the end of the month for the majority of it and by the middle of next month for the ultra cold. I think everything, I'm sure there's some other stuff I haven't thought about yet or that we haven't thought about. But I think as prepared as we can be, also even looking at if we have to distribute during cold weather. I've been working with Hamilton County Public Health on some capacity for both in-building and then mobile testing or mobile vaccination. So I think as much as we can think through, there's no perfect disaster response, I always like to say, or emergency response, but I think that we are as prepared as possible and that we will continue to be prepared through the entirety of the event.
Awesome. Thank you so much.
Our next question is also for you, Nick, and it comes from Ann Sinker with the Inquirer.
Yeah, hold on. I've kicked Nick out for 1 second. I just want to elaborate on something that I know Nick has told me in the past. So this idea about the capacity to hold, receive and hold the vaccine, while EMA has a facility and we are getting the equipment on site to do that, there are many partners in this community that are helping with this effort, including the coroner and the hospitals, right? Because they, think about that. They already have some capacity in their facilities to house the vaccine. And especially the coroner, we've got a brand new coroner's building coming online in Blue Ash, and so she already has a lot of this equipment installed, and so we have talked to the coroner about her ability, before that facility even opens up for the operations of the coroner's office, to house a vaccine in the freezers that she has. So I just want to emphasize that this isn't, EMA is the coordinator, and the city of Cincinnati obviously is a partner, but we've got many partners that we have reached out to, and they have reached out to us to say, how can we help in this effort? And so it's a very broad countywide effort.
You're up to the Inquirer.
Hi there, Nick. This is Ann Saker at the Inquirer. So what was the market like in trying to purchase freezers with ultra cooling capacity? Was it like the scramble for PPE in April, or is there a lot on the market and you had your choice?
Actually, when we started looking, again, I reached out. It's been, time is a bit of a scramble at this point. A couple months ago now, we have a procurement process that we follow in government. We're good stewards of the taxpayers' dollars, so we were actually able to get quotes on what we needed. We sized what we needed, and we luckily gave it enough lead time for delivery that ours is coming in. I know that some other people, I think regular walk-in freezers are still available. Ultra cold is a specialty item that I think some of the delivery dates are out a little bit, but still within plenty of time to receive the vaccine. I've heard the January as some of the ultra cold coming in for some people, but our process is really, we're hitting the mark about right on where we needed to be.
Thank you.
Scott Wortman from the Inquirer. He has a quick question for you, Director Crosley, and then also for the commission.
Can you hear me? Morning. Just a real quick question. Denise kind of touched on this a little bit with her comments a minute ago. The vaccines that you guys will be storing, is your storage facility going to be the main like storage, or for like all the hospitals you use, or like only for a certain subset of the vaccines?
So it's really because you don't want to ship it too often, too many times. When I say store, it's store and then get it out. I mean, that's sort of our goal. I was actually just talking to Commissioner Kesterman about that. But we are one reception point in the county. So the best way to distribute the vaccine is and I think that this has been out there for a long time, they're going to do a lot of direct shipping, which is why they hired McKesson to do a lot of that direct shipping. So it's much easier to direct ship to the hospitals. It's much easier to direct ship to medical clinics. The major drug chains have been mentioned. And then we will be allocated a certain amount because public health will be involved in setting up public vaccination, as well as working with our local public employees, first responders, things like that. So we are one point of the storage capacity within the Cincinnati or Hamilton County Metro.
And this is at your these freezers are at your the EMA's facility, then offices. Is that correct, or where is this physically at?
It's at a different location that we have where we store our personal protective equipment in the county. It's a warehouse.
And you said you are working with the surround. Is there like a coordinated response with the surrounding counties, potentially working together on increasing storage capacity and getting this out, or how's that working? The collaboration.
Well, so of course we coordinate with all the regional Southwest Ohio emergency management agencies. I also coordinate through the Health Club and through Commissioner Kesterman. We coordinate with all local public health. So the Health Club is helping us with the public health and the medical center, the medical field coordination, and then we're coordinating with local EMAs. So, for example, oftentimes because we have more capacity than some of our neighbors, if the state calls and says, do you have room to store X, and we'll offer that. So we are and would help our neighbors if needed. I know that they're trying to find distribution sites in each county rather than, again, having to move the vaccine too many times.
Thank you. I have a question for Denise as well. Looking at the stay-at-home orders, beyond asking people to not gather in large groups, does the county plan on issuing any other like advisories or anything to compel people to not have large gatherings this holiday?
That's a good question. I am in conversations indirectly with the other commissioners here in Hamilton County on that point. More to come on that. We have a couple meetings before Thanksgiving, but yeah, more to come on that front.
There will be something, but you won't say what it is exactly, or?
Up front.
Sorry?
Yeah, I want to make sure we're all in lockstep. I don't want to speak for the whole commission without having us all in lockstep, but more to come on it.
Thank you. That's all I have.
Thank you.
We have a write-in from Fox 19, and they would like you to elaborate on the additional support that the commissioners are going to consider tomorrow in regards to schools. CARES Act dollars.
Yeah, so thank you for this question. We're going to talk about CARES Act for a second. So remember, this is the $142 million that we received from the federal government in response to COVID-19. Has to be spent by the end of the year at this point. We have not gotten the extension we asked for because the federal government hasn't taken any action. So with that in mind, we have some dollars that have dropped to the bottom that have so far been unspent because some programs came in a little bit less than what we anticipated. And so we are working with that dollar amount, knowing that we got to get the dollars out by the end of the year and going back out and saying, what are unmet needs that we missed kind of in the first go around? And we've been talking to the schools. Our response when it came to increasing Wi-Fi access outside certain facilities was a response to what we heard from them. Some kids doing homework outside the school setting need access to Wi-Fi, so we tried to respond to that, and we did. This one is more of a response to, hey, we know schools are really struggling. They have gotten some resources from the state in particular, but they have spent money on COVID-19 response. You know, think about plexiglass and other things that they've done in their buildings. How can we help in that space as they continue to struggle with in-person, virtual, hybrid learning? And so as a response to what we've heard from those school districts, we are allocating dollars to help in that space. And so the dollars are available to any school district, really any school in Hamilton County, up to a certain amount. We have said that it cannot exceed $50 per student in any school, so that's the cap. But any school can apply for these dollars. We have to have evidence that it is being reimbursed for expenses related to COVID-19. But beyond that, any school can apply. So that is we're just trying to help in that space in a way that we, didn't have the ability to do earlier than now.
Thank you, Commissioner. One more question from Corey Sharber with WVXU for you.
Hey, Corey.
Hey, Denise. Thanks for taking my question. In a conference call with Senator Rob Portman, he discussed that a Gallup poll that showed only 50% of Americans were willing to get vaccinated. Are there concerns within the county government that people are simply not going to go get vaccinated, kind of like how people aren't following the guidelines for COVID-19 that have been set out?
I do feel as though this is a question for Greg Kesterman, and poor Greg has been very quiet today, so he misses answering questions. So I'm going to kick to him, but what I do want to say as a preface is that we are doing the work, public health is doing the work to make sure that everyone in this community, and so is EMA, has access to a vaccine that will eventually keep us all safe and save lives. That's our job, right? We cannot compel people to do things that they simply refuse to do, and it's a bit of a head scratcher. I liken it to mask wearing, as you did. It's a bit of a head scratcher. We know what works. We know how to keep each other safe, and some people are unwilling to do it. Okay. Our job is to make sure that we keep this community as safe as possible, and that's what we're going to do. So I'm going to leave the rest of the answer to Greg.
Well, I think that was perfect, but I will add, ideally everyone in the community, as the vaccine becomes available, would take it. But just like any vaccine, we know that's not the case. The really good news here, though, is this vaccine is 90 to 95% effective, which means that if a few folks don't take it, as a community, we are much stronger because of the effectiveness of this vaccine. So we will work with many of our partners. We will work to get the message out that the vaccine is safe. It's been tested and checked by the FDA as well as the vaccine manufacturers. And so we are dealing with a safe vaccine, but we'll work to make sure that we're messaging and getting folks the information they need to make an educated decision and hopefully take the vaccine.
Okay. Thank you, everyone.
All right, very good. So thank you all for jumping on. Thanks to Nick and Greg, as always, for being here. You know, next Wednesday is the day before Thanksgiving. We will be here doing a briefing on next Wednesday. I think things are moving very rapidly, and so I don't feel compelled to cancel that. So more to come, and also to you, Scott, more to come on how the county is responding to what's happening, not only at the state level, but here in Hamilton County. So thanks again for joining. We'll see you next week.